This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Well, this week we're focusing on matters of the heart leading up to Valentine's Day. You know, our heart does so much for us. Think about it as the pump that keeps your body going.
Yeah. Now, unfortunately, many people just don't take care of their heart like they should, which is why the Centers for Disease Control and Prevention reports heart disease is the #1 killer of both men and women.
Let's first look at how it affects women. The American Heart Association reports cardiovascular diseases kill about 1 woman every minute. 90% of women have 1 or more risk factors for heart disease or stroke. And this is scary. The association reports fewer women than men survive their first heart attack.
All right, let's go to the guys now. According to the CDC, heart disease is responsible for 1 in every 4 male deaths. Half of the men who die suddenly of coronary heart disease have no previous symptoms. And between 70% and 89% of sudden cardiac events, like a heart attack, occur in men.
But heart disease goes much deeper than heart attacks.
There are many types of heart disease, and there are many conditions that can lead to it. So joining us today to tell us more is Dr. Stephen Hearne, who is the co-director of the Guerrero Heart and Vascular Institute at PRMC. Dr. Hearne, thank you for coming in this afternoon.
Thank you for having me.
So let's lay a blanket out here. Heart disease, what exactly is it?
Well, heart disease, that I guess as you're alluding to in the introduction there, it's most people think of it heart attacks related to high blood pressure, smoking, cholesterol. Although there are many types of heart disease, or congenital heart disease, valvular issues that you're born with, valvular disease that develops later in life. But the predominant thing that, you know, the bread and butter of cardiology and general medicine out there is cardiovascular disease, which typically is, you know, blockages in your coronary arteries, which cause, you know, angina, chest pain, heart attacks, and strokes and those sorts of things.
Yeah, and we mentioned the prevalence of heart attacks, but not all problems of the heart present themselves as heart attacks. What are some other things we could have?
Well, there's also many different presentations. There's irregular heartbeats. There's a disease out there called atrial fibrillation, which is an irregular heartbeat. It's really a disease of aging. You know, people in their 80s, about 20% have this problem. It's not a life-threatening problem per se, but it really raises your incidence of stroke, and you have to be treated with blood thinners and anticoagulants. There's valvular heart disease that a lot also develop with aging. Your valves block up, they get calcium built on them, they need to replace them either via their leg for a percutaneous route or open heart surgery. There's cardiomyopathies, which are the fancy term for weak heart muscles, which develop from viruses, different drugs we give. Go on and on. There's many different facets of heart disease. But again, the one that the population I think knows about the most is the cardiovascular disease, the blockages, the heart attacks, the things that.
So what about men and women? Is there a lot of difference? Is one of us more likely at risk for anything?
Well, at a younger age, certainly premenopausal, the women have it over the men, hands down. You know, really? There's definitely a protective effect of estrogen.
Right.
Women tend to get heart disease on average 10 to 15 years later than men. However, once they get it, they tend to do worse with it. But that's again later in life. And the reason they do worse, a lot of it, there's been a lot of publicity out there about the atypical presentation for women, the undertreatment of women is true. Women don't a lot of times present the same symptoms as men do with heart disease. They don't have the classic, you know, substernal chest pain, crushing, elephant sitting on my chest, sweaty, short of breath, that men typically get.
What does a woman show?
Sometimes they have a little ache in their shoulder. They have a little headache. They have, you know, an earache. They have a lot of different manifestations of cardiac disease that you're not really always on the lookout for.
Jaw pain.
Jaw pain is that's a fairly classical symptom, but women tend to get that even a little bit more than men in terms of a symptom. So
let's talk about risk factors. What are some of the risk factors for heart disease?
The big risk factors: high blood pressure, diabetes, smoking, high cholesterol, family history. Some of those are fixable, some are not. Your family history, you have what you have from your mom and dad. The diabetes, most of the time, or a lot of times, you can fix by not eating. You know, overeating is going to kill more people in the U.S. than terrorism ever will.
And you mentioned cholesterol.
Yes.
What kind of numbers should we be shooting for?
Cholesterol numbers, the latest guidelines, recommendations that came out really don't go after numbers, although again, most cardiologists and internists like numbers, patients like numbers. It gives them a goal to shoot for.
Right.
If you have heart disease, cholesterol is broken down into 4 different components. There's a total, there's a good cholesterol, which is your HDL, there's a bad cholesterol, your LDL, and then there's triglycerides, which are also typically bad. So if you've had heart disease, if you've had a heart attack, I tell my patients when they come in, doesn't matter what your cholesterol is, it needs to be lower. So they get put on cholesterol lowering therapy. It doesn't matter what you start with, it's got to be lower. Because the person that starts out with a total cholesterol of 130 has a heart attack. If he gets down to 80, he gets the same benefit as someone starts out at 250 and gets dropped to 180. So if you've got the disease, you need to be treated for it. Numbers in general that that we shoot for: bad cholesterol or LDL cholesterol is below 70, triglycerides below 150. We like the total in the 180, 190 range. Your good cholesterol, we like above 40 to 45. The higher the better, which is your HDL.
So you talk cholesterol. Let's talk blood pressure. What are we shooting for?
Well, those guidelines also just got revised within the last year, and there's been a lot of heated debate in the cardiovascular community about that. They got softened a little bit for patients over 60, up to 140 over 90, even to 150 to 90 over 90 for patients in their 70s and 80s, and those are the guidelines: 150 over 90 if you're over 70, and 140 over 90 for anybody younger. A lot of cardiologists out there would argue lower is better, which if you look at survival curves, the lower your blood pressure is, the better off you're going to be, down to a point about 110, 120. So my patients, when they come to the office, we like to get you between a systolic or top number 130 to 140 and your bottom number below 90. Those are, I think, reasonable goals.
Okay, so high blood pressure. There's a new device that's come out called a coupler.
Yes.
It's supposed to help bring down your blood pressure.
Yes.
Tell me about this thing.
So the coupler is a little conduit, if you will, between your femoral artery and vein. It's put in your leg, a little surgical kind of a graft that connects your artery to your vein, and it's kind of a pop-off for your blood pressure. That's the theoretical advantage behind it. It's being developed over in Scotland. There was an about 83, 84 patient trial that just made one of the medical journals.
Which isn't very big yet.
Not huge, no. In the cardiovascular world, a good sized trial is 12,000 patients to 25,000 patients. So this is a very, very preliminary thing. It's a phase 1 study. Of those patients, their blood pressure dropped by about 15 points systolic. So
which
pretty
is good.
Pretty good lowering. However, about a third of them got fairly impressive leg swelling on the side the surgery was done. So they had to wear stockings, take meds. So, I mean, the kinks are not all worked out in it, but, and it's fairly early on. It's years away from being approved here, but
if you could boil it down, Dr. Hearne, what could we do? What's the one thing we could do to reduce our risk of heart disease?
Don't smoke, number one. Eat less. I mean, shoot for an ideal BMI. Which prevents you from getting diabetes, high blood pressure, and watch what you eat. I mean, I tell my patients, it doesn't mean never have a steak, but anything in moderation.
Right.
And, watch your calories. Exercise 30 to 45 minutes a day, every day of the week if you can. Just a brisk walk. Doesn't have to be a marathon run, but walking and getting out and being active are really the keys to preventing.
It's really simple,
heart
but it's
disease.
really important.
That's exactly right.
Dr. Hearne, thank you.
Thank you very much.
Thank you. To read more from PRMC about proper heart health, go to WBOC.com, click on our picture at the top of the page.